I would like to appreciate the leadership for accepting my research project titled Diagnosis of Pancreatic Cancer with EUS FNA, Factors that Influence Adequate Sampling, for Egypt's 12th International Workshop on Therapeutic Endoscopy. My name is Lankarani. I'm a third-year gastroenterology fellow at Allegheny General Hospital, Drexel University in Pittsburgh. My disclaimer is that I'm not an endosonographer. However, I will be trained in a therapeutic advanced endoscopy fellowship at Mayo Clinic next year. I would like to thank my mentor, Dr. Manish Dwan, for his support during the last year when I was working on this project. Pancreatic cancer deserves a special attention as the fourth leading cause of cancer death in the United States. More than 35,000 patients will die from this cancer in 2010, and unfortunately, 5-year survival rate is only minimally above 5%. Although EUS is sensitive, it is not specific enough for making the diagnosis of pancreatic cancer. EUS FNA increases the specificity of the test for making such diagnosis. Tissue diagnosis is a mandatory factor when neoadjuvant chemotherapy or palliative chemotherapy is needed. EUS FNA is the modality of choice for obtaining pancreatic tissue. Usually more than one needle pass is necessary to obtain enough material for making an accurate diagnosis. When available, on-site cytopathologist can confirm the adequacy of the sample. On the bottom of the screen you can see the example of EUS FNA in adenocarcinoma of the pancreas. On to the right you can see example of EUS FNA in neuroendocrine tumor of the pancreas. The clinical question that I wanted to answer was to identify the factors that may influence the number of FNA passes to make accurate diagnosis of pancreatic cancer. I believe this information is valuable in the setting that on-site cytopathologist is not available or in developing countries with limited resources. I retrospectively reviewed the previous 6 years' data on patients that were diagnosed with pancreatic cancer with EUS FNA. I analyzed the effect of fine needle aspiration needle size, location of the mass, size of the tumor, and endosonographer's experience on the number of needle passes necessary for making the diagnosis of pancreatic cancer. Total of 188 patients were included in this study. We showed pancreatic tail lesions required a statistically higher number of needle passes to obtain enough cytology. Also, we were able to demonstrate that the first 25 independent pancreatic EUS FNA in a newly trained endosonographer required a higher number of passes for obtaining enough cytology. This number subsequently plateaued and remained at a lower level. Other variables including fine needle aspiration needle size and tumor size did not have a statistically significant influence on the number of FNA passes needed. I would like to appreciate for your time and attention to my study.